We've got Guam Memorial Hospital Administrator Lillian Posadas with the latest on what's happening at the Guam Memorial Hospital. Good morning, Lillian.
Good morning. Hi.
Hi.
Morning, Guam.
I guess today,
Go
right?
ahead.
Today, before we get into the COVID census, the members of the EMAC team, they are departing, right? Okay. Any words
Yes.
for them?
Some of them are departing, yes. And we just really want to say thank you so much for their great help. The nurses, the doctors, and the respiratory therapists, the 4 respiratory therapists. It was just a tremendous boost to the challenges with regards to especially with the individuals, COVID individuals who are really, really ill. These last several weeks and the time that they were here, it was great help.
Okay.
So we wish them well wherever they go. 9 are remaining, though. They granted our extension for the 9 CCRNs and the 1 physician who is an intensivist. And so we're very, very fortunate, and we're very blessed, and we're very grateful that we still have some of them with us with the transition of the New West staff coming on board. So that's a great help.
Right. Lillian, can you just remind us again, how long is that extension for?
Up until October 4.
Okay. So they're just sticking around a few more days to help the New West people coming in.
Acclimate and get oriented and get feel comfortable knowing the organization, where things are. So yes.
Okay, Lillian. So I guess if we could get the latest COVID census.
Sure. As of this morning, we have 27. We had like 3 admissions yesterday, and then we had the 2 deaths yesterday. Of the 27, 10 of them are on ICU level of care, and of the 10, 7 of them are on ventilator support. In addition to the non-COVID ICU COVID ICU patients, we also continue to have non-COVID ICU patients with us, and so they're on ventilator as well. All three of them are on ventilator.
Lillian, can you give us any additional information on the 2 fatalities related to COVID yesterday?
Yes, the first individual was a 61-year-old individual who was in the hospital since September 15. Was not on a ventilator, was on a BiPAP, supplemental oxygen. And unfortunately, because of his multiple underlying health conditions, his body was just so, his, system was just so, I guess, compromised, and the COVID infection just really exacerbated all his condition, and he just, succumbed to the infection. Then the second individual who expired at around 4:16 p.m. yesterday, 70-year-old male individual. He was on supplemental oxygen also, and so he had multiple underlying health conditions. And so, our condolences to the family, and our prayers. It's sad to see when we lose the battle to this COVID, and they, we lose them, and it's sad.
Right, Lillian, it is so sad, and what's more sad is these deaths keep coming. Almost 1 a day, a lot of times 2 a day. How do we keep from going numb to this, to getting used to it?
Well, I'm not sure that we're going to get used to it, but if we can try and catch these individuals early, as soon as they start having the symptoms, get medical attention, come into the emergency room and get, checked and get seen. And if your respiratory system is compromised, we need to get the treatment started right away. And, hopefully before that, even if you're asymptomatic, take the necessary precautions and really, wear the mask. And it's been touted that vitamin C, supplemental vitamins, can help also. So it's really trying to prevent and taking care of, especially those individuals who are vulnerable. with multiple underlying health conditions, give them that respect that you don't want to transmit or you don't want them to get the infection. Take the extra care that they are protected. And you protect yourself as well.
You know, we interviewed the widow of Renee Tamanda, the customs officer who was one of the COVID-related fatalities. Tragic story, Lillian, as she was telling us her husband is a very healthy guy, a spear fisherman, you know what I mean? Very, when talked to us, always moving, always doing things all the time. But the story
Yeah.
she told of his battle with COVID, just so tragic because, I mean, especially she didn't really get to say goodbye to him.
I know.
Yeah.
That's the heartbreaking part, is, we can't let them, see each other, other than just virtual visitation. And, really it's just to try and protect the spread of infection. And it is sad and it's heartbreaking. And I'm so sorry for the families. But, maybe this is something that we'll just need to revisit and see how we can, at least one family member, the immediate family member, and see how we can accommodate that. But I don't have an answer right now, but definitely, we'll discuss it further and see how we can allow at least the family to say their goodbyes or to, at least to be with their loved one. So we'll explore that.
I wanted to follow up on the 150 emergency field beds that recently arrived on Guam, and there was a release that 50 of them were designated to go to the Guam Memorial Hospital to augment the surge capacity there. Are you guys using them, or are
What
they
was
in
that?
storage?
The blue medical tents? Is that what you're saying?
Oh no, we got a release from Guadalupe about these emergency field beds that
Field
arrived.
bed.
Yeah,
Okay. All righty.
yeah. So you guys,
Uh,
go ahead.
Just tell us
We,
about
we
it,
haven't
Lillian.
gotten them. We haven't gotten those beds, but those have been in discussion. Tomorrow, I will attend the ops briefing with the governor and the rest of the cabinet members who are, part of the COVID response. And so, I'm sure that that will be on the agenda to discuss, and we'll find out. But we haven't gotten the field
Okay.
tents, not at this time.
Okay. How I guess now that more businesses are reopening, we're gonna start seeing indoor services for masks. How are you
Right.
guys bracing yourselves, or how concerned are you that we might see, more cases if people aren't careful and if people let their guard
Right.
down?
We are concerned, and just like yesterday, we had 3 admissions. And we're also seeing female individuals, who are pregnant. We're seeing them come in, and so we're accommodating as best as we can. And we are able to accommodate. We have beds available now. We have the infusion of the newest staff individuals with they have COVID experience. There are specialized nurses in ICU, in ER, in telemetry, and hemodialysis, and so we're prepared to receive as they come in.
Lillian, when these patients come in and you do the intake and your staff is talking with them, what are they saying about how they were exposed to the virus?
I don't have that information, but yes, that is part of the assessment when they come into the emergency room. The nurses and the doctors, they try and get as much information with regards to the exposure so that, our in-house team, infection control and employee health, they do the contact tracing in-house, and they communicate with public health to then also continue the contact tracing in the community. But there are times that individuals, and we've seen it, they say they're not COVID positive, or they say that they don't have it, but then when they're tested, they have it, and they said, "Oh, yeah, I forgot," or something like that. But there are individuals, and for whatever reason, they're afraid. Maybe, I don't know, but we do have some individuals who come in and say that they don't have it. But for the most part, individuals do report that yes, they got tested outside, they got tested at their private clinic, at public health, and yes, they were tested positive on certain days. Some of them are not tested, but we test them when they come into the emergency room. That's a standing protocol.
Right,
Is that
right.
whoever comes in, they get tested.
What about the pregnant women? What can you tell us about them? How many? Because you said women.
I was going to get the numbers this morning, but we're seeing quite a bit, probably already a dozen of women that have come through.
Is that's what's the average number?
I didn't get the
Oh,
numbers. I'm
no, I
sorry.
mean
I
that
was going to do
that are
that.
typically at GMH.
Well, one or two. Yesterday we had two, I believe, that came in. So, they're not in large volumes,
Mm-hmm.
but it's noticeable
Mm-hmm.
that we are getting women who are pregnant and have positive COVID tests.
Right.
And fortunately, the newborn are, we test the newborn, we categorize them as PYs, and they get tested. And fortunately, the results have come back negative on those newborn.
What kind of challenges in terms of care do these pregnant women present when they're COVID positive and they come to the hospital? Do we have to? Are there different protocols for pregnant women than there are for, let's say, a 30-year-old guy?
30-year-old woman.
Or I mean, just so how is it different when you treat a pregnant woman who's COVID positive?
Not much of a different other than, the medical attention is going to be geared towards more of the pregnancy and the baby. So they monitor them as a typical labor and delivery patient. And, then the doctor, the OBGYN doctor, if there are some internal medicine concerns, they then consult an internal medicine doctor. But for the most part, the focus is on just the laboring and the delivering care that they're here for. If they are, if they need to be to have cesarean section, or if they are scheduled for cesarean section, they do get tested also prior to going for surgery.
Is it getting tighter to find space to separate the pregnant COVID patients and the non-COVID pregnant patients and even the
No,
newborns?
no, because again, they're not coming in large numbers. So, knock on wood, they're not coming in. One or two are manageable. And when the baby is born, we do have an area in the nursery to keep the infant isolated. And only certain staff are assigned to care for that. They don't float back and forth with the non-COVID infants. And so, just like with the non-COVID L&D patient, specific staff are assigned for the female individual who is pregnant. And we're using one of the rooms in the ICU. It's an isolation room in the ICU. Like I said, it's manageable because it's one or two that come in, not in large volumes. So, for now, it's manageable in terms of, the number of pregnant women who come in.
Right, but for the COVID women that are there, they have. You said there were like 12, right? And do they have to stay there for 14 days, right, after they deliver? I mean, how does that work?
No.
No.
They don't have to stay for 14 days. If their conditions are stable enough, they stay maybe 1 or 2 days to be monitored.
Mm-hmm.
And if they're not manifesting, respiratory conditions or symptoms, and their postpartum is stable, they get released home with the instructions that they have to isolate at home if they
Wow,
can.
that's got to be
If they
tough.
cannot, they go to the government-sponsored ISOFAC. But for the most part, they get discharged home and to continue the isolation.
Is
And they're followed up by public health to ensure that they are keeping themselves, self-isolation. And until they, 14 days, and then they probably get retested to make sure that, they're cleared.
What's the protocol if the mother is positive and the baby's negative in terms of the mom leaving the hospital? What happens with the baby? Does it then go to other family members?
Not other family members, but like, maybe the father
Right.
and other members can take care of the baby while the mom is isolated and recovering.
Because I know we have a lot of pregnant women on this island on any given day. Has there been a case or any case where the condition of the mother, in terms of the virus, worsened to the point where there had to be like an emergency C-section or any
We
acceleration
had
of the delivery?
one individual early on in her pregnancy, and so unfortunately she lost the baby, and so we're still keeping her here in the hospital in isolation. So that's one isolated case that we have.
Can you tell us any more about that?
Not really, other than it's a young woman in her with her second pregnancy, and so she is COVID positive, and so we are keeping her here and taking care of her, managing her until hopefully she recovers from this infection.
Terrible. Gosh.
Yeah.
Did the baby have COVID?
Did
What
the
did you say?
yeah?
Is that
So
what you said?
did the baby have COVID too, Lillian, or was it just that the
Not
mother's?
yet. But we're still we're still monitoring her. No, the baby no.
Okay.
The baby was tested.
The baby
No,
didn't
she
make
hasn't
it.
delivered the baby.
Oh.
She's still in her yeah.
Wait, what?
So she lost the baby, but the baby's still inside of the mom.
Yeah, I'm going through the natural process.
Yeah, I thought I asked you that the last time you came on, if there was any instance of well,
Yeah.
okay. No,
Just keep her in her prayers.
Right,
Keep all the
right,
patients in
right.
your prayers.
but the mom is fine, right? She's not like
We're monitoring
on a
her.
ventilator or receiving ICU level of care or anything like that, or
She is in an ICU level of care, yes.
wow. So just to go back to the beginning, Lillian, there's a patient at the hospital who is pregnant, who has COVID in
And lost the
ICU level
baby.
care, lost the baby, but the baby is still inside the womb. Is it her condition that prevents you guys from operating and taking the baby out? And
Well, that's really the decision of the OBGYN doctor that would just, we're monitoring her because of the many medications that she is on. So, they're just making sure. And they want that, it goes through the natural process.
is
Yeah.
are there underlying health conditions or comorbidities with this woman?
That I don't think so. She's a young individual. I don't think that she has underlying medical condition.
Well, so definitely we'll pray.
Yes. Pray
Uh,
hard.
Lillian, anything else? Has anyone else passed from the virus since the announcement was made last night that we lost two?
No, there wasn't any during the night. So, hopefully no more. Just have to pray hard, but no more.
Right.
all right. Thanks, Lillian.
Thank you too. And
Okay.
take care. Take care, Guam. Please continue to really try and practice the preventive measures.
Okay. Stay
Thank you,
safe.
Lillian.
Stay safe.
It's a serious situation.
Yeah, no.
And
I agree.
there's nothing fake about this. There's nothing that nobody, we're not making anything up at all. This is really our reality. And so we just need to continue to fight this battle together from all ends, from all angles.
Yeah.
Thank you, Lillian.
All righty. Thank
God
you.
bless
Take
you.
care.
Wash
Okay.
hands. Okay.
Bye.
9:43. It's the Link of the Breeze, 93.9. We'll be right back with more.